Take you to the story now. South Africa, together with the global community, celebrates World Breastfeeding Week in the first week of August. According to research, breastfeeding offers unmatched health benefits for mothers and their children. While this is known, South Africa faces low exclusive breastfeeding rates, which contributes to undernutrition and severe acute malnutrition. Let's find out why and what can be done to change this. Dr. Lesley Bamford is child health specialist at the Department of Health, joins us now. Thank you so much for your time, doctor. So before we speak about the benefits of breastfeeding, what are the challenges of breastfeeding and how widespread are those challenges?
So good morning and good morning to the viewers, and thank you for this opportunity to talk during World Breastfeeding Week. So I think the benefits of breastfeeding have become quite widely known, and the majority of our mothers actually know and understand some of those benefits. And we see that many women do initiate breastfeeding in South Africa. But we know that most women are not able to sustain exclusive breastfeeding for the first 6 months of the child's life. And that really is key to maximizing the benefits from breastfeeding. So obviously, as the Department of Health, we work throughout the year to do our best to promote and support and protect breastfeeding. But during Breastfeeding Week, we have a particular focus on looking at what has been done and what needs to be done better to improve and to ensure that more children in South Africa really benefit, receive the benefits associated with, first of all, exclusive breastfeeding for 6 months. And then ideally, we recommend that mothers should breastfeed until the child is 2 years of age, because we know that those two behaviors in combination really ensure that children get the best start in life.
And talking of that best start, how can you tell if a baby is no longer being breastfed?
So, I mean, it's not a test that we do. So obviously, but we know that if we look at a population level, we have high rates of undernutrition in South Africa, particularly children being stunted, meaning that children are not achieving their optimal height. And we know that we have high levels of stunting in South Africa, and we know that we have low levels of exclusive breastfeeding. And so we know that those two are linked, and we have a lot of work to do to support mothers to breastfeed. So as I mentioned, I think many people now do understand that there are many benefits to breastfeeding. Of course, there are benefits for the child in terms of optimal nutrition, optimal growth, optimal development, protection from infectious diseases such as diarrhea and pneumonia. And we know that there are benefits for the mother to breastfeed in terms of reducing the risk of some cancers. However, as I say, we know that breastfeeding rates are low in South Africa. So we always think, what is contributing to that? Our understanding is that mothers do not receive enough support to breastfeed, and that support needs to come from our healthcare workers, but it also needs to come from the community at large, be that the households that mothers are living in, their partners, their extended family, and the community at large. We also know that many women stop breastfeeding when they return to work, meaning that support for breastfeeding at workplaces remains insufficient. So our response really needs to be to provide mothers, households, the community with information about the benefits of breastfeeding, but also to make sure that mothers are supported not only to initiate breastfeeding, but to continue that breastfeeding, exclusive breastfeeding for 6 months. And as I said, ideally continuing then to breastfeed together with providing the child with high quality complementary feeds until the child is 2 years old.
And you actually just touched on a very important aspect as well around support as well as the various households as well. So is enough being done, in public hospitals to promote breastfeeding, especially when it seems so easy to substitute it with commercial milk formula, for instance?
So I think there's always more work to be done. So as I indicated, we do know that 80% or more of mothers do initiate breastfeeding. So mothers in our hospitals, when they come to deliver during that immediate period after delivery, are breastfeeding. But we know that many mothers then stop breastfeeding once they leave our health facilities. So it is challenging to provide that support on an ongoing basis because, of course, breastfeeding happens in households. So as I indicated, our view is that this really is everyone's responsibility. As the Department of Health, we are constantly working with healthcare workers to make sure that they are providing mothers with support as best they can. But as I indicated, it really takes support from the mother's environment, her household, her partner, the people she's living with, as well as the workplace and the broader community to support mothers to continue to exclusively breastfeed.
It will be a combined effort indeed, Doctor. So let's talk about the Mother-Baby Friendly Initiative and Kangaroo Mother Care, and how does it assist in improving the care and outcomes for mothers and their newborn babies?
Okay, so if we talk about Kangaroo Mother Care, I think some people know what that is, but really it's the practice whereby the baby, and particularly preterm or small babies, are cared for skin to skin with the mother. So the mother carries the child against her skin, and that has been shown to have numerous benefits. It improves the survival of the infant, but also promotes breastfeeding. So many of our hospitals do practice Kangaroo Mother Care, have facilities to ensure that mothers can stay with their preterm infants. But there is still more work to be done to make sure that every preterm infant in South Africa can benefit from Kangaroo Mother Care, and that mothers continue to practice Kangaroo Mother Care once they are discharged from our hospitals. The Mother-Baby Friendly Hospital Initiative is really an initiative that aims to ensure that all efforts in our hospitals are focused on supporting mothers to breastfeed successfully. Obviously, during that period, many mothers are initiating breastfeeding, and that's a very important period. So again, many of our hospitals work very hard. They follow the 10 steps that make up the Mother-Baby Friendly Hospital Initiative. But of course, there's always work to be done to make sure that we strengthen our efforts to support and protect breastfeeding.
And Dr. Bamford, is it a permanent lost opportunity for the baby if the mother is unable to breastfeed or does not choose to? So absolutely. There is overwhelming evidence that breastfeeding is natural and that it is associated with optimal growth, nutrition, and development. And that's the message we really want to get across. Of course, there is a
a very, very tiny proportion of women who, for some reason, cannot breastfeed, and there are alternatives available. But really, the vast majority of women with the right support can successfully, exclusively breastfeed for 6 months. And that's what we really need to work towards.
And doctor, one of the reasons some may not want to breastfeed is due to the changes to breast appearance. What options are there for the mothers out there?
So there are many myths around breastfeeding. So many of the changes to women's breasts are actually associated with pregnancy rather than with breastfeeding itself. So those are some of the barriers. The other barriers, I've already talked about workplace barriers. I've talked about, or there is pressure from other family members. So many people in South Africa, perhaps particularly the older generation, believe that children really need to, or believe that solids should be introduced early in a baby's life, before 6 months. And there's really no evidence for that. But often young mothers will receive poor advice or pressure from other family members. So our understanding is that those are really the biggest barriers. Inadequate information or incorrect information, inadequate support, particularly at household level. And then thirdly, in some instances, mothers needing to return to work or to tertiary education and not receiving the support in those environments which they should.
And doctor, of course, I know parenting can be quite daunting, particularly for first-time parents. What support is there that is available to them, particularly when we also try and zoom into things such as breastfeeding?
So, of course, mothers need support. We try and provide as much support as we can. We provide messaging and information through our Road to Health booklet, which is supplemented by a campaign called the Side by Side campaign, which really aims to ensure that parents receive the information that they require in a way that is practical and easy for them to understand. And then, of course, our community health workers play a very important role in supporting breastfeeding in the home. And I've mentioned our healthcare workers. So we have support from a wide range of stakeholders, including partners, as you mentioned, our partners such as UNICEF and WHO, and also other organizations that work closely with us around support to parents and support to breastfeeding. So there is a lot happening already, but as I've indicated, the support that mothers need to breastfeed is not always available at that exact moment when the mother requires it. And in a sense, that's what we really have to work to address.
Of course, that's Dr. Lesley Bamford. She is child health specialist at the Department of Health. Thank you so much for your insights this hour.